Welcome back to another episode of Derm Docs, everyone. Today we have a part 2 special with Dr. Lorenc. Dr. Lorenc is a world-renowned aesthetic plastic surgeon who balances surgical expertise and an acute aesthetic sense of composition and proportion in the areas of facial rejuvenation, breast enhancement, and body contouring. He will be leading a live Cadaver workshop this fall, and you don't want to miss it. Listen to the details all in this podcast today. Hi, Dr. Lorenc. It's so nice to have you back on Derm Docs today. Welcome.
Hello, Melissa. Nice to be with you as always.
Thank you. It's such a pleasure. So I want to start by asking, when deciding how to manage cellulite, which patient characteristics do you consider most strongly when selecting a course of treatment?
Well, first of all, I have to ask the patient what bothers them the most. So that's the first thing. And also be very realistic as far as the expectations of the treatment. Probably as far as the characteristic, the most important thing that one has to evaluate is whether there is just cellulite or there is elasticity or lack of elasticity of the skin or redundant skin. Because if you do treatment just purely targeting cellulite on a patient that has redundant skin, you can make it worse. And obviously that's the most important assessment that I think the physician has to make before the treatment. And I think that's critical for the success of the procedure, whether it's a surgical procedure or an injectable procedure, for instance, an enzyme, a collagenase, or even a hyperdilute filler. You really have to make that assessment first.
Okay, well, that makes a ton of sense, actually. And on a different note, why is the understanding of facial anatomy so important, particularly in the lower face and jaw, for providers when selecting injection patterns?
Well, it's all about, first of all, it's about safety, of course, because you have to know the anatomy. Anatomy is really your savior when it comes to injectables, whether it's fillers or toxins. Mm-hmm. And when it comes to fillers, it's obviously related to the possibility of vascular compromise. So you have to know the anatomy and specifically the location of the arterial supply and really anywhere on the face. And when it comes to neurotoxins or neuromodulators, you have to know what I call or refer to as the functional anatomy of the musculature of the face, because you have to know which muscle you are weakening. And there's such an interplay and complex interaction between the agonist and antagonist muscles on the face. You have to understand that. And the way to understand that is to completely understand the anatomy. And that's very, very important in the face. And lastly, or secondarily, is the fact that the effect of, so safety is number one, but the second is really the effect and the longevity of the procedure and certainly the patient satisfaction that you can derive from using an injectable, whether it's a filler or a toxin. And that's related, again, to knowing the anatomy and applying the right filler, so to speak, or right agent in the right anatomical area. And the lower face certainly is rather complicated because you have a lot of different structures. There's a very dynamic interplay between the muscles of the lower face and the platysma, and you really have to understand that.
Mm-hmm. So it's definitely a case-by-case basis, correct?
Well, absolutely. The other thing that we didn't touch on yet is the assessment, patient assessment. And I think that's something that tends to be overlooked, but I think it's critical to assess the patient. Everybody's different, and the anatomy is different. There are some variables in the anatomy, so you have to understand that. A perfect example of that is I mark every patient for an injection in animation before I do the injection. And I think that goes to, or sort of underscores the point that everybody's different and you have to adjust your treatment based on each individual patient's anatomy.
Okay, thank you. Wow, that's very interesting. And as you know, the South Beach Symposium is expanding to the West Coast this fall, and we're very excited. So because you practice in New York but teach and lecture nationwide, do you notice different aesthetics on the East Coast versus the West Coast?
Absolutely. I happen to have a California license as well, and I'm very happy to be part of the expansion, so to speak, to the West Coast. There are regional differences, and it doesn't have to be as far as New York and to California. Even Florida has different sort of aesthetics than happen right here on Park Avenue. West Coast definitely, and even within California, whether it's Northern California or Southern California, there are differences, and it's a difference in aesthetics, not only on the facial aesthetics but also on body. For instance, size of the implants that we use in the Northeast, for instance, specifically in New York, is very different than the size of implants that are used in South Florida. And this is based on data from the manufacturer. So this is reality. But also as far as facial aesthetics, there seemed to be a little bit more of a conservative approach on the East Coast versus the left coast. But it also is individualized. There's also a mixture. We have a lot of patients from the West Coast come to New York, and I'm sure it happens also vice versa. So, but one has to be cognizant of the fact that there are some differences in the aesthetics. That's real.
Yeah, I know the snowbirds go back and forth, so you probably have to just know how to deal with every sort of aesthetic there. What might a West Coast provider be more interested in learning based on their patients' needs?
Well, I think, so again, there is that different aesthetics or sense of aesthetics on the West Coast. I think you have to individualize it. I think you have to be very specific and very exact with your patient's pre-procedure, whether it's an injectable or surgical procedure. Talk to them, speak about their expectations, present what reality is, and put it in the whole context of rejuvenating, whether it's the face or the body. But I think a very in-depth discussion. I spend a lot of time with patients pre-injection or pre-procedure. I think that's one of the most important things that you can do. And that really almost guarantees a good outcome. Otherwise, miscommunication can really lead to difficulty post-procedure.
And live derm education isn't just for dermatologists. So how would you say our extender audience of physician assistants, nurse practitioners, and other providers can benefit from SBS, and particularly from your Cadaver workshop?
Well, I think that I'm biased because I think it's such first of all, I love teaching the course. And it's a very comprehensive course. It's not only a didactic lecture, but it's also hands-on cadaver experience, using injectables, whether it's fillers or toxins, and even placing sutures in place. It also allows you to verify placement of fillers after I sort of show you how to do that. So it's a very comprehensive way of learning about the anatomy and really the functional anatomy, as I mentioned before. I think it's critical, and whether it's physicians, nurses, or physician extenders, PAs, or nurse practitioners, I think it's critical that everybody's knowledge of anatomy is really at the same level. And I think that's important because anatomy will guide you really in a safe plane, so to speak, and it really benefits the patient. So I think anatomy is important for everyone, physician extenders, and I have been teaching courses throughout many years, specifically targeting physician extenders, nurse practitioners, and PAs and nurses, because I think it's such an important aspect of keeping patients safe.
Yes, you have, and what wonderful educational experiences that you've taught. Can you give us a few more highlights about your Cadaver workshop? It's a really exciting workshop that everyone should sign up for.
Well, of course, everyone should sign up for it because I'm leading it. No, but you should sign up for it because it's very informative. And a lot of, it's not only, a didactic lecture or even a cadaver dissection, live dissection, and your ability to handle fillers, toxins, sutures on a cadaver head, and then verify its placement. There's a lot of practical information because it's constantly what I project throughout the whole course, and it's an extensive course and very in-depth course, is there's always a clinical correlation. So throughout the whole course, I always refer back to choosing the right filler, choosing the right toxin, or the right amount based on each anatomical area. And to me, that is probably the most important aspect of that course. So you will learn about the anatomy, you will learn about different agents, but now you will learn how to match anatomical areas with the physiochemical properties of the agent, which if you do that, you will get a better result. So it ultimately benefits the patient. And I welcome you to join the course, and I hope to see you there in August.
Absolutely. And we're so excited for that. Is there anything else you'd like to share with our audience today, Dr. Lorenc?
No, I just think this is South Beach is just an amazing symposium. I've been part of it for a number of years. I love the location. I love teaching anatomy. And this is not just an anatomy course. And I think what's important is that in my course, what you have is a combination of three different things. You have someone who is an anatomist. You have someone who I have published over 100 articles on fillers and toxins and their physiochemical properties. And then lastly, you have someone who has extensive practical and clinical knowledge of using these agents. And I think when you put those three things together, you have a course that's very different than what's out there. And I think it's separated from everyone else because it combines these three different aspects. And I invite you to join the course and experience it. And hopefully we can share with you some of the thoughts and some of the advances, and really looking at even the future of what's coming down the pike as far as development in fillers and toxins, which of course I include in the discussion during the course.
Well, thank you so much for your time and all of your wonderful knowledge today. We really appreciate it.
You're welcome. My pleasure.
Thanks for listening, everyone. And don't forget to rate, subscribe, and follow, and leave us a 5-star review. Until next time, have a great day, everyone.